South Africa's medicines regulator is urging government to end its suspension of the J&J vaccine. The Johnson & Johnson program was halted following blood clot cases in the US, but SAHPRA says there are no major safety concerns and it's suggesting closer monitoring of high-risk individuals instead. I'm joined now on Zoom by ISibongiseni Dhlomo, who is the Chairperson of Parliament's Health Portfolio Committee. Thank you so much for your time, Dhlomo, this afternoon. So you are now being asked by SAHPRA to essentially lift this the suspension of the inoculation program. Is that what's going to happen, or do you feel that it's necessary that it continues?
No, you got it wrong. It's not us who must lift up, it's the minister. We are a portfolio committee for health. We listened to Minister Mkhize on Wednesday, a day after they had actually taken a decision to temporarily suspend the Johnson & Johnson vaccine based on the information that came from the FDA and the scientists in the US. He did inform us that it's going to be extremely temporary, and they were consulting with the scientists internationally and locally. We are confident that it's not going to be very long before they decide to lift, because it was actually, as this SAHPRA is saying, it was not because there was something that was extremely wrong with Johnson & Johnson. It was 6 patients in the US out of 6 million that have already been vaccinated. We have just vaccinated about 300,000, and we have not had any incident of a severe adverse events. So we support, and we know that it will not be distant future, the ban is going to be lifted. So
who are you in agreement with exactly at this point, Dhlomo? Is it SAHPRA or is it the minister? Because obviously SAHPRA is saying that the suspension should be lifted immediately, and the minister is obviously saying that it needs to be suspended for a time so that we essentially make sure that these clots are not something that can happen to South Africans as well. So you're saying that you're understanding either of the side, but which one do you agree with?
SAHPRA is saying the issue of safety and efficacy is not being questioned. That part we agree about. It's the information that came from the other country. And in fact, when the minister was reading the statement, he says, look, we have agreed with the scientists that we cannot ignore this matter that has been brought to our attention by another country. In fact, even countries in Europe have decided to halt a bit. The unfortunate part for us in South Africa is that while we suspend J&J, we don't have any other vaccine right now to fall back on. Hence, we actually urge the minister, while we agreed with the minister the day he made a presentation, we also were agreeing that this suspension should be extremely temporary. There are negotiations, there are findings with the scientists in the country, in lies with the other scientists in the world, should actually allow us to start again. So I would not be able to say we support this and that. We are actually understanding that you can't ignore the international opinion. However, our situation is that we must work quickly and faster and remove that as a factor and then start the vaccine. I don't think there's a conflict between the two. SAHPRA is quite right to say they are looking into the efficacy and the safety, and as far as they are concerned, there's nothing that actually talks to that. But the scientists in the world are saying, please check this part, and we are saying to the minister, please do that quickly and come back to indicate to us that you are restarting the vaccines.
Dhlomo, let's say in about a week's time the suspension is lifted and the inoculations do continue. Do you feel that it is advisable for the inoculations to be happening with the J&J vaccine, even though the US decides that it's not going to lift the suspension on J&J and that it does not trust J&J's vaccine? Is South Africa still confident that this will be the right vaccine to use?
We are looking forward to the scientists of our country debating this matter and advising the minister. But we are very confident that we will start with the J&J very shortly. It's just that we don't have a luxury of any other vaccine in the country. And again, the benefit, if you look at the cost-benefit ratio, the benefits of continuing with the vaccine far outweighs the challenges that people are raising. Even in the US, 6 people affected out of 6 million. Really, yes, one soul is one soul too many, but we need to consider going forward. I mean, look, right now, 2 days ago, the minister was actually opening up electronic registration for people 60 years and above, because the process is continuing and we will not be deterred by this process. But however, this temporary suspension should still make us to prepare going forward. So even if the US will continue, sometimes, because maybe they do have a luxury of other vaccines which we don't have yet in the country, we should, guided by our scientists, go back to start the J&J vaccines shortly.
Dhlomo, you're saying that we don't have the luxury of other vaccines. Could this particular suspension and this kind of concern that has now come up maybe not give the health department that kind of urge, or rather that encouragement to go, looking for other vaccines, perhaps, I don't know, Sputnik, for example?
No, we are aware that the Department of Health has already ordered the vaccine, the Pfizer vaccine, and it's going to be landed. I mean, there are 30 million already that will be sent in batches. The Sputnik and the Sinopharm are other vaccines that the process has actually. Sometimes maybe it's also the SAHPRA that will also indicate what the department is ready and willing to buy as soon as they can actually be cleared up from SAHPRA in terms of Sputnik and Sinopharm. Those ones, I think they're at the level. The last briefing from the minister was that it was at the level of SAHPRA still to consider giving those ones a full registration. But the Pfizer one is there, but we have not started as yet. The one that we're currently using is now this one affected by J&J. So we are saying other countries may say, look, okay, let's hold on to J&J because we've got Pfizer, we've got Sputnik that's already up and running in their countries. We don't have. So right now, tomorrow, if we were to restart, we only restart J&J, and the Sputnik and the other ones may come in also after the recommendations or registration, full registration by SAHPRA.
Just very quickly, Dhlomo, before I let you go, is there no concern from the Health Portfolio Committee of this particular situation playing in the hands of anti-vaxxers and people that are concerned about vaccinations and the rollout itself?
Fortunately for us, we have gone past that, and we were thinking there were concerns and fears, but all South Africans are eagerly waiting to be vaccinated. There may be one or two few here and there, but the wave of anti-vaccines, we really don't have seen it in the country. And where we meet, where we hear as a portfolio committee, we see South Africans who are willing and are looking forward to be vaccinated because they now know that this is one additional important safety measure in the light of vaccine. Now, look, what does this vaccine do to you? Among other things it does, it actually makes you, yes, you still can get COVID, but you will not get worse COVID that can either kill you or send you to the ICU. So everybody will be looking forward to that. Hence, by the way, that is the reason why we say even after being vaccinated, please wear a mask, social distancing, sanitize, because you will still get COVID. The only thing that will probably not happen to you if you are vaccinated is that COVID is not going to be too worse to admit you to the ICU or to make you die.